Innovation, imagination, wonder. These are just some of the words used to describe Dr. Harvey Passes. Dr. Passes explores interesting people and ideas that will stimulate you. He questions the people who develop, create, and employ novel concepts in business and everyday lives. He especially loves to speak with successful people. How did they do it? How can you do it too? So let's join Dr. Harvey Passes in his quest of wonder and curiosity as we watch Dr. Harvey Passes Presents.
Some shows back, I did an interesting show on Alzheimer's. And if you were watching it, you would have had a pen and paper with you, so you could take down some notes, because 1 in 10 people today, it looks like, come down with Alzheimer's, and probably the number is even going to grow. Well, I had as one of my guests a terrific, informative, resourceful physician, and his name is Dr. Max Rudansky. He's a neurologist. That's a physician who practices diseases of the nervous system and helps to cure you and prevent. And I asked him, after we had a very interesting conversation, if he would come back and discuss with you today what he was discussing with me the last time, and I found it so interesting that he said, absolutely, I'll come back. So here he is coming back, and stay tuned right now. And by the way, get a pen and some paper, because a lot of great information is going to be there for you to learn and make use of. So without further ado,
Harvey.
Max.
Thank you for inviting me back.
Oh, it's great. You were terrific. I enjoyed my conversations with you. You were charming, you were affable, and you were informative. So let's first remind the folks at home again who you are and what your background and all that kind of stuff, and then we'll get right down to it, because I think that you have great stuff today. Dr. Rudansky, Max Rudansky, he's Chief of Neurology and Director of the Stroke Unit of Huntington Hospital, which is part of the North Shore LIJ Health System. And you're also co-director of the Traumatic Brain Injury Unit at St. John Land Rehabilitation Center in Kings Park, New York. You're also co-director of the Center for Neurohealth in Huntington, and you've been in private practice for 24 years?
Yes.
That's wow,
yes.
24 years. You don't look old enough. Okay. And neurohealth, which, well, this is what you're all about. This is an integrative model for the diagnosis and treatment of neurologic disorders, particularly, get a load of this, prevention of memory loss, stroke, and headache. You know, you're busier than me. I don't think that's possible. How can you? My God. All right. So let's get right down to it. This is really fascinating. First, let me just let my buddy at home know something first. Dentists always tell you, you want to take care of your teeth, you must practice prevention. You brush, you floss, you make sure you go to the dentist at least 2 times a year, and on and on and on and on and on. And a lot of other health sciences practice prevention. Well, did you know that there is also that same philosophy in neurology, in disorders of the nervous system? And
well, Harvey, it's a developing philosophy. It's actually something that we have taken and learned from our holistic colleagues who have been saying this for a very long period of time.
Saying what?
They've been basically saying that disease is really the end stage of a whole series of things that if you can get to early enough, you can make significant inroads in preventing the disease process. So where conventional, traditional neurological approach has been that after you develop Alzheimer's disease or after you've developed a stroke, then you see your neurologist. The approach now in integrative care is prior to it. So now we're talking really about what can be done to prevent the functional decline that will result in a disease process, is getting to things at the earliest juncture.
Well, the first thing I'm sure is flossing. Okay, let's go on. All right, that's for another show. Okay, now, what I'd like you to do, you mentioned it in your opening statement, that there's integrative medicine, there's alternative medicine, and there's complementary medicine. Right. Briefly, what are each of these? Right. What is integrative, what is alternative, and what's complementary?
So integrative, it's a bit of an issue of semantics. Integrative basically is saying that you're looking at all aspects of a person's well-being and trying to maintain health as opposed to just intervening at the disease phase.
Okay.
I like the term complementary as opposed to alternative. Alternative sort of means like the traditional approach is sort of out-fashioned. complementary means that what types of things can we take from the holistic realm and use it in a complementary fashion? So it's not
instead
so much
what is it? Leukopic for tomatoes,
right, lycopenes.
Lycopenes, rather.
Right.
Okay, so instead of lycopenes, have a tomato.
Right. No, it means that over in addition to taking medication like statins and blood pressure, which are necessary,
Red rice seeds.
Right. Then you want to begin to look at what other things can be done in a more natural way
Right.
without beginning to think that the medications per se are an evil. So it's really trying to integrate and bring the best of both traditions
Of all worlds.
to play into the individual.
So then the physician in this particular circumstance has to have his mind and his eyes and his ears open to all facets, not just be very parochial in your thinking and just say, oh, it's only an aspirin and you can't do anything else to get the fever down, for example.
Absolutely. It's taking a broader, more inclusive approach in terms of maintaining health as opposed to just treating disease processes.
What about the distinctions between nature versus nurture? Does that still apply?
Yeah, well, that's an interesting battle that's been going on, which is actually beginning to get a little bit outdated. So now where it used to be thought, well, how much of this is genetic? Like how much is the development of Alzheimer's disease or stroke pertaining to the fact that your genes have been sort of, weighed against you? How much of this has to do with nurture? Like how well do I take care of myself? What is my diet, exercise? So now we see that really it's neither either or. It's
combo.
It's a combo, and one affects the other.
The cultural anthropologists have taught us about the nature of aging and its effect on memory loss and mental fitness. Discuss this, because you might be exploding some things here.
Harvey, I think this is, I brought an very interesting study.
Let me hold this up,
please.
I'll hold this up so my camera people can you try to get in a shot of this? And then explain, because I got to be candid with you, graphs are boring. Even though I'm a doctor, graphs are boring. So let's discuss,
Harvey,
what are we looking at?
This is fascinating, because this is basically showing that the attitudes that a person develops in their younger years will deeply affect how well their memory will function as they get into their later years.
Now show us what you
And basically what they showed was that a group of young people here compared to elderly people in America, in the United States, versus the very similar group of people on mainland China. And the distinction is that mainland China represents a traditional society in which the elderly are respected, they're looked towards in terms of their wisdom. And in Western culture, we begin to we're really more youth-oriented. And as people get older, they play golf, they retire, their value to society is less so. That notion almost creates a self-fulfilling prophecy. So if a person, when they're younger, feels that as I get on in years, my intelligence, my cognition will not be as valued, that translates into the fact that I'm not going to really use that brain, that muscle, in a way that will keep it fit. And on mainland China, traditional societies where they view the elderly as being wise and thoughtful and they seek counsel from them, that creates in their own sense that they have to keep their minds sharp and constantly be involved in activities that will help to maintain their cognition.
So from what I'm getting from this graph and from what you basically just said, is the fact that in our Western civilization, the older you get, the more you're treated less respectfully, and that your value to society goes down. And as a result, your ability to remember and to use your mind effectively actually begins to decrease. Whereas in China, this totally changes. I mean, according to this graph, the Chinese have more than a 2 times higher amount of memory ability and cognitive ability to be able to function, and they're revered and respected, whereas the old people here are treated like garbage. And it's your fault. No,
exactly. And the incidence of quote-unquote Alzheimer's disease on mainland China is significantly less. The disease is actually not dissimilar, but the numbers of people who perceive themselves as having memory problems are much less. Because for many people who have memory problems, it's really basically disuse. The brain, which is a glorified muscle, has become deconditioned because on some level we feel we don't really need to use it as we get on in years.
Very interesting. Very interesting, that whole thought. Besides, they probably didn't send their kids to school with aluminum foil for the sandwiches, and the aluminum got in the brain and giving them Alzheimer's disease. But that's for another
theory.
show.
Another theory.
Another theory. Okay, so that's very interesting. Yeah. So use it or lose it.
That's it.
That's what I'm hearing from you.
That's a huge part of it. And there's a lot of science that backs up that concept now.
Very important. Do you know, that's the reason why I do this show. It keeps my mind going. Did you know I'm really 92? Okay. All right. So let's talk about now something very interesting, and that's primary preventive programs. And what can primary preventive programs, what are they? You alluded to it earlier. And what can people do?
So we've actually learned a lot from our cardiological colleagues, who the significant inroads in terms of less heart attacks, people dying less of cardiovascular disease, and in fact living longer, so that now memory and aging becomes more of an issue. So what do they teach us? They basically said that if you could get to the risk factors of any particular illness early enough and intervene at that point, you'll have a significant advantage in preventing the disease process. So what we talk about primary prevention neurologically is getting that blood pressure under good control, treating that cholesterol, looking at overweightness. I mean, looking at the basic lifestyle risk factors and addressing those at a point in which a person can still change their behavior, as opposed to saying, okay, now you have a disease process, take this pill and let's see the best you can do with it.
Let me interject something. The first two things you mentioned, excuse me, blood pressure and cholesterol, those are silent killers.
Absolutely.
You don't know you've got a problem. Then you mentioned overweight. Well, that ain't silent. Okay, but the first two, you don't know that your cholesterol is 350, is 375, is 400. You don't know all of these things. You don't know that your blood pressure is up until it's too late.
But Harvey, one of the things that people really don't know,
you've got to go to the doctors, what I'm saying.
You have to go to the doctors, and in terms of just thinking in terms of aging of the brain, memory, how is my brain going to age? Most people associate high blood pressure, high cholesterol, diabetes, cigarette smoking with vascular risk factors. I'm going to have a heart attack, maybe a stroke. I want to prevent those. But if we're speaking about just maintaining cognition, memory, the vitality of thinking, there's a direct correlation with the treatment of blood pressure and cholesterol. So that's a whole understanding that most people, even in the medical community, really don't have, in the sense, how important is it to drive that blood pressure down if you want to maintain your memory as years go on. And it's not just related to the prevention of stroke. It has a direct effect on how healthy the brain cells are going to be maintained. So that issue of like a public health issue of getting that blood pressure down, getting the cholesterol down, even if it requires taking medication, it's better to change lifestyle and exercise and look at your nutrition. But at the end of the day, you got to get that blood pressure down. You have to get the cholesterol down.
Very, very, very significant, very important. You mentioned something a moment ago, and we discussed this earlier before we went on the air. You said that you had a graph in here, or a little, well, actually a graph, or picture, an image about synapses. I would like you to show that. I want you to discuss this. Let me hold this up, because you spoke about healthy brain and maybe a brain that doesn't function too well. Let me hold this up so that you could see this, and see if we can get a shot of this and explain what are we looking at? We're not looking at just at a red tree and a green tree that's from an upside-down Rorschach test or something.
It happens to be a good metaphor, because what we're looking at is a brain cell, a neuron, and all of these tree-like branches, tentacles are really the synapses, and the degree of one's memory and ability to think and concentrate is directly correlated with how many of these synapses. It's not so much the neuron, the brain cell itself, but as we get on in years, what happens is that the number of synapses and the connections that the neurons can make with other neurons begins to become diminished. This shows the adverse effect of stress, just stress, controlling for all the other factors, age, blood pressure, cholesterol, trauma, just looking at what does stress do to the the brain
Synapses.
cells, to the synapses. And you can see here, this is a study that was shown in which a tree shrew, which is a type of rodent or squirrel, was placed under a certain amount of stress for a short period of time. And you see how nicely the normal structure is. And after a period of stress, the significant loss of synapses after a period of stress.
It's like in the winter, losing some leaves and losing the branches.
And when you lose those branches,
it becomes bare.
That's what correlates with forgetfulness.
So this reminds me of, thank you, this reminds me of a computer. And a computer can process information by having all the chips with more and more of these synapses, these things to let all of the information just go back and forth.
That's the connection. And I think we don't realize when people are under stress and they feel that they're becoming more forgetful, they can't remember things, and they attribute that to stress, is true, but it actually, in fact, has a real biological component to it. So a person is not imagining that their forgetfulness, and of course it raises concern that they have Alzheimer's disease. But they, in fact, they don't have Alzheimer's, but they have a neurologic problem pertaining to the adverse effect. The stress releases cortisol, and cortisol, which is a hormone which is released from the adrenal gland, has a direct toxic effect on the brain cells that have to do with memory.
No
so
kidding.
You're really talking about stress biologically being a toxin to the brain cells that have to do with memory.
What will cortisol do to the brain cells? Will it dissolve it?
It actually
like
causes it to undergo atrophy or degeneration. It's actually a degenerative process and is working on the synaptic level. So it's a biochemical toxin, same way we would have nicotine, or if someone's exposed to PCBs or mercury, has a toxic effect on brain cells. Stress has a similar toxic effect biologically. So a person, in fact, is losing synapses when they're under stress, and as that evolves into anxiety and depression, that's where you see that a number of people who have depression have very similar looking forgetfulness that you see with people with Alzheimer's disease. Different process, but a similar effect on the brain.
You know, it's interesting. I love when you come on the show because I learn things from you, and the greatest compliment I can give you is that I learned from you.
Thank you.
And I learned from you. So what I'm hearing from this first 15 minutes of the show is that if you want to have a really good neurological system, you truly, again, it comes back to the basics. You must eat and drink and sleep a healthy life. You must cut down on anything that will cause you adverse stress. You must get a checkup and make sure that your weight is in order, that your cholesterol is at an appropriate level, and your HDL and LDL are at the appropriate levels. And you must check out your blood pressure and get that under control, because it's more than just a cardiovascular problem. And you're stating in just one, I'm sure there are other methods or other manners as well, other than just a cortisol relationship. But cortisol is a direct relationship where it's going to directly affect your ability to think cognitively, to understand, and to process information, as opposed to going, where's mama? One of those kind of things. And this is fascinating. It all comes back to the same thing. Eat well, exercise, do the right things, and you'll have this. And you'll have this.
Harvey, what you're saying is what a professor at Harvard said was that the NIH has spent millions of dollars.
National Institute of Health.
The National Institute of Health has spent millions of dollars in research to come to a clinical understanding what our mothers have always been telling us, which is basically you need a good night's sleep, you need to eat well, don't be under too much stress, and exercise, brush your teeth. That the message that we're getting in terms of how to prevent disease has to do really with how to stay healthy. And it's really going back, and it's interesting now that we have science, people are beginning to listen. Maybe if we had listened a little more carefully to our mothers, we would have saved a lot of money and be a healthier society.
Yeah, that's absolutely fascinating. So now let's take this to the next step. So an individual who's watching this show and says, gee, I'm really concerned. I'm overweight, and I don't know what my blood pressure, my cholesterol is, and maybe I really should go and get myself a checkup. But, my memory, I'm 65. I'm concerned about my memory. I can't remember as easily as I used to. I'm concerned that I'm coming down with Alzheimer's. And now, Is it true that if it's memory loss, it's Alzheimer's, or what you're saying now, there are other things? Discuss that for a moment.
Most of the time, when a person themselves feels that I'm losing my memory,
right.
I should see a neurologist, I'm concerned that I have Alzheimer's disease, the majority of time, it's not Alzheimer's disease. When a person is not aware that they're losing their memory, and a spouse or children become aware that dad, mom is having difficulty, and they bring the person, then you have to be a little more concerned. But for the vast majority of people who become aware that I am not thinking as sharply or as well as I should be, when they come to see a neurologist, the focus, over and above getting involved in these very sophisticated MRs and spectroscopies and PET scans to sort of prove the fact that this is not Alzheimer's disease, it is something. And what that something is imperative to be able to make that diagnosis. And usually what it has to do with is just these factors, age-associated effects of lifestyle, hypertension, diabetes, obesity, an overly sedentary lifestyle, too much stress, not sleeping well. Perhaps there's some residual effects of attentional deficit disorder that's playing out. Perhaps there's medication that a person's taking, cigarette smoking. So to a degree that a person can feel that these lifestyle issues can have that significant impact upon my thinking, my memory, as opposed to just making me a little bit more tired or short of breath. In effect, the message we have to get across is that these seemingly benign lifestyle issues, which up until a certain point a person has been able to compensate for, will take its toll cognitively. And the emphasis really has to be not so much to label this as a disease. Most of the time it isn't. It's really functional decline pertaining to things that a person can do something about. That's really the message.
That's my next question. So Harry Heimowitz comes to you. Not related to any real Harry Heimowitz that I know of anyway. So Harry Heimowitz comes to you, and Harry says, I'm really concerned. And you say to yourself, after looking and checking and ruling out, and you say, I think this is just one of those circumstances where the individual is just losing some of those synapses, and the dendrites are shrinking up, and everything is going on. Okay. Is there a way for that individual to take his synapses that exist and increase them?
Yes.
So this is not irreversible damage.
Not at all. And again, at what point are we intervening? And to a degree that a person can identify why are these synapses shriveling up, and they can make some changes in behavior, which is the most difficult aspect to this, or proactively get involved in using their mind, exercising that brain.
What can an individual do?
Okay, so
you got someone 87 years old, and everybody's saying, all the kids are saying, she's mama's beginning to lose it. And as a result, let's pack her up and bring her into the nursing home.
That happens to be the exact point, is that when a person begins to show some forgetfulness, somehow from a societal point of view, they begin to get more marginalized, more isolated. She doesn't really understand. She's not contributing as much. She seems a little bit out of it. So people tend to withdraw. That's the point in which a person has to become more engaged. And what happens a lot is that families fragment. A person can't drive, they can't get to the community center, their friends have either passed away or gone south, and progressive isolation is really the factor that significantly weighs in terms of a person losing their ability. You have to be engaged, you have to be social, and you have to be creative. That a lot of people who have certain creative interests, as they get on in years, they sort of let those things go by the wayside. So we rely a lot on the left side of our brain. But the right side is also an equal partner. And the right side has to do with creativity, getting back to drawing, doing pottery, working with crafts. But Harvey, we're just saying in terms of that social engagement. So, we begin to sort of say, well, what assisted living, what nursing home should a person be in? In these traditional societies, what the siblings argue about and fight over.
Money.
In Western society. In those societies is who's going to take care of mom and dad, who's going to have the honor to do so. We have a sort of a different attitude in a sense, and that again is where assisted living facilities or community centers or elders programs in which not just to go and have a hot meal, but to get back in life, socially engaged,
be challenged, be mentally challenged,
be socially engaged, enjoy, laugh, begin to participate again, as opposed to becoming a spectator. And even not a spectator, but someone who's really now in the bleachers. So you got to bring them back down to field side and get back involved. And that doesn't mean watching TV. or even passively reading the paper. It really means going to a club, being involved in a reading group, getting back into things that have to do with creativity, re-engaging in life.
And challenging yourself.
And I mentioned to people that it may be an oversimplification to a certain degree, but the brain is a glorified muscle. And the same way that we don't use a muscle, we stop working out, we're not playing tennis anymore, rapidly as you get older, you get deconditioned. So if you puff up a flight of stairs, you don't have muscular dystrophy. You're deconditioned. And if you're beginning to get forgetful, it's not because you have Alzheimer's. Is that glorified muscle has not been utilized to its best capacity.
When I went to dental school, I remember when we took neuroscience and the like, one of the discussions was that, well, it's inevitable that as you age, you're going to lose brain cells. Is that true? Well, how does this work?
I think that's the major breakthrough.
Is that a myth?
It's now a myth.
It's a myth.
And it's only in the last 15, 20 years that it really basically was conventional wisdom that as you got on years, neurons faded out. Neurons could not regenerate themselves.
That's not true.
So that's not true.
Neurons do regenerate themselves.
They regenerate themselves. Synapses can grow. That there is a real regenerative, restorative ability that the brain has, but it has to be activated, engaged. It's not a passive process. And one of the things that happens with stress, as I pointed out there, is that stress prevents those regenerative cells from getting activated. So not only is it having a negative effect on the synapses, it's also blocking the natural regenerative ability, what they call this plasticity, meaning that the brain has it's very dynamic,
right,
and is able to regrow synapses, regenerate neurons, and this is really one of the large areas of investigation, how to get those neurons to regenerate themselves.
You know what you've done today? We're just about out of time, believe it or not. It's amazing, 30 minutes like that. You know what you've done today? You've not only informed, but you've done something that you didn't use the word, and I'm going to throw it out. Hope. Hope. What you've done is to help that person, you listen to me, you have just received hope. And the hope that you've got was from this gentleman here explaining that the brain is a muscle, not unlike, your biceps, and that it goes into disuse, but you can bring it back.
You can.
And if you're 85 years old and you're watching this right now, use it or lose it. Get engaged. Talk. The human body it's remarkable.
Absolutely remarkable.
It's remarkable. Its ability to bounce back.
Resilience.
Resilience. That's the word I was looking for, but I'm losing it, so I forgot. But thank you so much for helping me with that, Dr. Max. That's great. But the point is, there's hope. That just get back into the things. Like from the Alzheimer's Foundation. You can go down there and meet with people and talk and learn and be and see and do. I think it's terrific. We got about like 2 minutes left. Give me in a minute your final terms. And by the way, would you come back again another time?
I would love to.
Because there's many more questions.
Yes, I would love to.
You're a wonderful guy.
I would love to do it.
You're
informative
this very much. And you're fun. It's terrific.
Thank you very much.
If I don't forget your name.
Thank
anyway,
you.
So in a minute, just right now, give us a little conclusion here.
I think the take-home message is that the basic lifestyle issues are critically important. How we live when we're 40, 50 years old, how we live when we're 20, 30, has everything to do in terms of attitudes, in terms of what we're doing physically, how we're responding to things emotionally. That really will determine how we do when we're 70 and 80. And this notion that it's about genetics and I hope I don't get disease and it's in the cards, it's not true. The vast valence of things is in our court. What we do 20, 30, 40 will determine the quality of life we will have when we're 70, 80 years old.
That's
good.
That's
the take-home message.
That's a good take-home message, full of a lot of hope and inspiration, backed by good scientific understanding, not just some nonsensical stuff.
This is neuroscience.
And also, from what you've also told me today, good neuroscientists, good neurologists, good physicians will make use of everything from all aspects of the world, not just from one parochial thinking. We're out of time.
It was really a pleasure.
Terrific, Max. You'll come back?
I would love to.
I got you saying that on television.
I would
now.
love to.
Okay,
Really.
terrific. You're a great guy.
Thank you very much.
You got a very nice wife. Okay. All right, so thank you very much. I hope you enjoyed it, and you learned a lot from Dr. Max Rudansky, and we'll get him back again. In the meantime, use it or lose it, but whatever you do it with passion. Dr. Pass is saying, see you again next time.